partnership with Keith. He is well informed, up to date on all the Medicare information, but for us, most importantly, is that he's a friend of us. He'll listen to you, he'll answer your questions, he'll try his best to get back to you if he doesn't have the information, but I'm really always glad to have him, and he's going to come back again before the end of the year to answer all the other questions before the sign-up period expires. So that's all. Welcome, Keith Nabb, back to that one.
Thank you, Victoria. You're so kind to me always. How many years now? Maybe 7? About 7 years.
Even during COVID,
we did. One of the cool classes we did, I told my friends about it. We did a class here where 70 people were here and 70 people were online. And it was like, man, what a great result. My name is Keith Nabb. I'm a native Atlantan. Are you anybody here a native Atlantan? All right, see here, out of all these people we have won, you win the prize. Where were you born? What hospital? Georgia Baptist. I'm across the line, baby. And I grew up in Tucker, here. And man, the changed. All of a sudden, we get all the people coming in from everywhere. All of you guys get in from everywhere, right? And if I ask the questions, I'm sure some of you will come from 10,000 miles away or 20,000 miles away, right? Maybe 14,000. And my job is to help you with Medicare, because where you come from, to hear the federal government here in the United States does healthcare differently than any other country on the planet. And people say, boy, I wish they would make it simple. And I say the same thing to my tax CPA. So sure, we think it would make things simple, right? And I won't have a job. But unfortunately, we're not there. We need a coach. She calls me a Medicare guru. I call myself a Medicare nerd. And that's okay. You want to embrace the nerds. You know, your mechanic is a nerd, your dentist is a nerd. You want to embrace your intelligent friends that'll help you. And that's what I have. I have a staff of now 11, soon to be 12. A new person starting next week. And we're the largest Medicare planning agency in Georgia. Affordable Medicare Solutions is a free service. You see on the card that has been put on your chair, it says very clearly, you can state that, as it's true, that we do not charge for our services. We're like social workers, we're not social workers, but we're like that. The government provides a system so that I can get paid to take care of you. And it's a free service. You can do it yourself. You can change your own oil on your car if you want to. But if you have to go pay somebody to change your oil, it's different. You don't have to pay me to help you understand your Medicare. I've taught over 1,200 classes, and today we're going to go over Medicare top to bottom, because some people in here are getting ready to start Medicare, and some people have already been in Medicare. So we're going to go over what Medicare is, but also where it's changing, especially in relation to certain drugs this year. Got a huge new bill, the Inflation Reduction Act, from President Biden has done a huge amount of changes for good. People can cross, everything looks good. And we're going to talk about how to prevent scams, because I'm sure you've all been called by people reporting that they're from Medicare or Social Security, and those are scams, and the government doesn't follow them. So we're going to go through this quickly in 1 hour, and I have a huge amount of resources flyers on that table, as well as puzzle books and other things back there that people enjoy, pens and papers, and want to take notes. And just raise your hand if you help with Mitchell. Raise your hand, Mitchell. Mitchell Flanders is my public relations director. He's my expert, but just raise your hand here today to bring you anything that you need, or if you want to ask me a question. We're going to try to keep questions to the end, but if I say something that confuses you, raise your hand. I'll try to address it at that moment to make sure that somebody else is involved and not confused by something that I've said, okay? So you get the formal Medicare solution, and we have to be very clear that this is educational. We're not going to talk to you about the blue company or the red company. When I use those colors, it's because I can't say their names, because we're not talking about company names or prices. The red company is the largest health insurer in America. Can't say their name. Well, I'm in the United States, but I can't say that, okay? I'm not employed by Medicare. I do this as a public service. And if any of you have gone to the Medicare website, medicare.gov, I use that every day. It's a great website, but don't go to medicare.com. If you go to medicare.com, they're going to try to sell you stuff. Don't give them your information. No plan names, companies, or prices will be shared. All the education flyers are there. But as a blessing of COVID, got to start teaching online. And I started recording my classes, and you have a YouTube channel now. The YouTube selling advertising online channel, get it turned off because you're getting enough popularity on learning about Medicare. So if somebody you know is not here today, just go to our YouTube channel and see a version of this class on our website, as well as other classes about how to get extra help from Medicare, how you prevent penalties for Medicare, and other information is on that website. Now, let's talk about me for a little bit longer. I've been doing this for 28 years, which is half my life. I'm 56 years old, and we serve all of Georgia. If you have friends that are in other states, you can help them also. I'm licensed in about 12 states, but I also have access to all 50 states and Puerto Rico and Guam for helping people. So here's the problem. 1965, Medicare was born. At the same time that Medicare was born, which was a program for all seniors 65 and older, the government created Medicaid. So people get those terms confused sometimes. Medicare is for everybody. Medicaid is for the low income or certain other circumstances, not for everyone, but we're going to have, all seniors are going to have access to Medicare. About 30% of people are going to get this extra Medicaid. Now, Medicare is not the same as Medicaid, of course, but it's also not the same as your employment insurance. If you're still working for an employer, you can have Medicare with your employer insurance. That's not a problem, except in one circumstance. And you can also have Medicare with veteran benefits. But you can't have Medicare with the Affordable Care Act. If somebody is using Obamacare or Affordable Care Act and you're 64 years old, they have to end it and move into Medicare when you're 65. We had hundreds of thousands of people screwing that up, and the government's trying to work on telling people you have to change the Medicare when you turn 65. This is important. Now, this is what they designed originally. When you started Medicare back in the 60s, they said, we're just going to give it to people that have been paying taxes for 10 years and their non-working spouse. If they turn 65, we're going to give them health care. And there's going to be a charge for part of it. But the main part, the hospital at the time was free. We'll go over that. But some people raised their hands and said, wait a minute, Bob got hurt. He's working at the railroad and he got hurt and he's only 52 years old. So they said, okay, we're going to create a program called Social Security Disability Income. That is where you give people income because they can't work and give them health care after 2 years. The government put a weird 24-month wait where if somebody was disabled, they would then get health care after 24 months. Don't ask me why they did that. But Obamacare has fixed that, where we help people when they first turn disabled, they don't have health care. We give them Obamacare and then move them into Medicare after 24 months. Well, that was a huge deal. We have about 9 or 10 million people now that are doing that are under 65 getting Medicare early. But there's another set of people that the government said, well, you know, why are we doing a 24-month wait if somebody has kidney failure? If somebody has Lou Gehrig's disease, they're going to die if they don't have proper health care. So before Obamacare came in, they created this third category, which said we're going to give people Medicare right away. In their 4th month of dialysis, we're going to give them Medicare. So there's 3 different types. They're expanding this. They're looking at some more diagnosis codes for certain cancers and other things where they might get Medicare early. So did everybody understand this? Okay. So this is what happened was they created Medicare back in the 60s, and the most important thing they thought at the time, and they were right, was hospital coverage. Everything was done at the hospital. My dad's a retired doctor, and he would tell me that he would tell me that he would go to the hospital for testing. You have a baby, and you would stay in the hospital for a week. That doesn't happen anymore. You have a baby pretty much all the same day. Today, most everything is done on an outpatient basis. This is the outpatient portion of Medicare called Part B. The inpatient portion is called Part A. Today, more than 50% of Medicare spending is outpatient. If you get a new hip, you get a new knee, you get a cataract surgery, all of those things are outpatient now. If you get cancer treatments, that's outpatient treatments. So more than 50% of Medicare spending is outpatient, and that's called Part B. No other health plan does this when it's split it up this way. But Medicare was created a long time ago. There is a premium under the outpatient portion, not under inpatient, but outpatient is a premium this year is $164.90. So $165 a month. Great deal. Great deal. If you're low income, the government will pay that $165 for you. Next year, this might be $170. They tweak it every year, they change it a little bit each year. So next year, we'll find out what that's going to be. And in November, we'll find out what that's going to be for next year. So what happened was the government said in the year 2000, the government said, we know that Medicare was created in 1965, 35 years earlier, and we saw all the baby boomers coming along, and the government said, we've got to fix Medicare to be more like regular health care that was happening under corporate health care, under veterans benefits and other health care had been changing in the 1980s and 1990s. Medicare was not changing. So they did a bill in 2003 and implemented it in 2005 called the Medicare Modernization Act. On the 40th anniversary of Medicare, they implemented this bill to finally include some things that Medicare didn't have, such as drug coverage. Isn't that bizarre? Medicare didn't cover outpatient drugs until 2005. I was in the first class in Georgia to learn about helping seniors with prescription drugs. It was bizarre to me because every health plan I ever had in my life had drug coverage. And I was learning that seniors didn't have drug coverage. It's crazy. So what happened was in 2005, the government said we're going to leave traditional Medicare, the traditional one created in 1965, we're going to leave that alone. And we're going to create a new side of Medicare and new benefits, and we're not going to force people to change. Why are they scared of seniors? Winnie knows. Seniors vote, and they vote in mass. The most reliable voting bloc. The government was afraid of taking on 30 million seniors, 25 to 30 million seniors back in 2005. So they said, we're not going to mandate you change. We're going to provide you options. This is really important. It says options. If you want drug coverage, if you want other benefits, you can decide on your own. Medicare decided to do this over 2 decades, from 2005 to 2025. And that change has now been extended until 2029. Now, if you compare that to the Affordable Care Act, that's where all the problems were. We're not seeing major problems in Medicare. Every year there's tweaks, they're fixing certain things, but that has problems. Under the Affordable Care Act, we saw a huge amount of problems from 2013 to 2017. It's kind of settled down now, but Medicare got it right. Did it gently, whereas the Affordable Care Act kind of forced things on people. Same government doing things differently. So let's not talk about 2005 quite yet, because remember, the government waited 40 years to improve Medicare. Well, during those 40 years, what happened was insurance companies decided to help out people that had Medicare. Insurance companies said, we're hearing people complaining about holes in Medicare. We're going to sell everybody little insurance policies all around the United States. Every little insurance company was creating these little policies called Medicare supplements or different names. The government said, this is crazy. We have 10,000 different types of policies. We're going to standardize them in the 1980s. So it was the first time ever that the federal government stepped in to standardize a healthcare plan. And they said, these policies that are coordinated with Medicare have to be standardized. And they made a mistake. They started standardizing them by using letter A, B, C, D, E, F, G codes. And already people said, wait a minute, we have Medicare A as hospital and Medicare B as outpatient. Why are you calling these new little insurance policies A and D? So they made a mistake. I'm not allowed to criticize the government, but if I was there, I would have done it differently. And what happened was these policies fixed a lot of problems with Medicare. They even provided drug coverage back in the day. Today they don't, but back in the 1970s and 80s, they did give people drug coverage because the government was not doing it. So since 1980, there's been some more changes to those plans, but look at this. This means over those decades, Part A and Part B was 1965, the Medicaps were improved in the 1980s, the drug plans were included in 2005. That means you have 3 cards to carry in your wallet. And a lot of you might be doing that are here. You've got your red, white, and blue Medicare card, you have your insurance supplement card, and you have your drug card. Those are 3 cards to show your doctor, your pharmacist, your hospital, etc. That's the most classic traditional Medicare situation, and half of my clients utilize this method. Very good, and we'll talk about the differences, okay? So this is what happened in 2005. 2005, the government said, we're going to create new plans that are only a single ID card, just like you have at your work. So the government said, we're going to create these, and we're going to hire the insurance companies to create these. The same companies that were creating the Medicare supplements said, we'll create these health plans based on what we're doing for the employers, the corporations in America. So they created these plans, and almost all of them include drug coverage. So you don't have a separate drug card. You still have to make your Medicare premium of $165 a month. But if you've heard Joe Namath and JJ, Jimmy Walker, Dynamite, talking about CPD, they say get your extra Medicare coverage. There is an imbalance in Medicare right now because all of the new innovations are here on this side of Medicare. Traditional Medicare is not getting any tremendous new innovation. Got a couple of little things. The big innovations are happening here, and the government knows it's a problem. President Biden said in his Build Back Better bill, I'm going to fix Medicare so that it's not so imbalanced. That bill did not get passed. Instead, they passed the Inflation Reduction Act, which was much smaller, a third or 20% of the size of the first bill. And that bill at least started dealing with drug coverage problems. But there is a bad problem in Medicare right now. All of these extra benefits we're going to go over are on the new side of Medicare, not the old side of Medicare, and I'll teach you about that. Okay? These plans, also, the government mandated that these plans would start using networks. Just like in corporate healthcare, when you have your job and you say, do you want the HMO plan or do you want the PPO plan? You have to put a check mark by which one you want it. Same thing here. You have either a health maintenance organization, which means mandatory doctors you have to use, or PPO. PPO means optional network. You can use our doctors or you can go outside the network and choose choice. So these plans were where the government wanted to start using targeted physician and hospital networks. Okay. Remember, you always have to make your Medicare premium, even when you're on this side of the plan. Okay. So what's going on at this point? People say, "Well, Keith, tell me what most people are doing." Just tell me what most people are doing, and it's not that easy. 50% of people are using the traditional Medicare supplements, and 50% are using the new modernized plans. That is nationwide. Faster than the government expected. It's amazing. In Georgia, we've been this way now for about 3 years. And they're expecting this to go to 70% and 30%. It's crazy how fast things have changed. So it's really up to you to customize and find out what is right for you, and I'm going to teach you how to do that. So we're going to talk about 3 columns here, the 3 columns, but we're also going to talk about the top line versus the bottom line, okay? So the 3 columns are, what doctor can I see to get my health care? The second column is, what the heck is this going to cost me each month out of my personal budget? How much am I going to have to spend each month to buy this coverage? And the third column is, what the heck is it going to cost me when I get sick to get better? Is it going to cost me $0, $500, or $5,000? What's it going to cost me? So if you have a Medicare supplement, that's the top line. If you have a Medicare Advantage plan, that's the bottom line. This means the new modernized side of Medicare. But I want to use myself as an example first, because I have Obamacare, I have an Affordable Care Act plan. I broke this ankle, some titanium in there. I have to write a check for $7,500 to get my surgery done before they would schedule surgery, basically. And I have a high deductible. I have an HMO, so a very small list of doctors to choose from. And my plan costs me $700 a month. Both of these plans are better than what I have right here. Okay, I have so many clients that come in and they're 64 years old and they're spending $1,200 a month, and they're so glad to move to Medicare. It's crazy the differences. If you're under traditional Medicare, you don't have the list of doctors. You just ask them if they take Medicare and are you seeing new patients. And instead of $700 a month, these might cost you $150, maybe $180 a month, plus your $165. But when you go into that broken ankle would have been almost free. I'm going to pay $226 instead of $7,500. I would have had enough money to go on a nice cruise, or a really nice cruise, right? Advantage plans, I would have chosen from a very large network, a PPO network, nationwide, all the hospitals in Atlanta probably, huge network, much more doctors that I could choose from. And I might have paid $0 a month. I'm getting the 165 here, but $0 in insurance company money. People say that's crazy. How do you get something for free? It's not free. You know this, and those are things free. Medicare pays the insurance company $1,100 a month to take care of you. And they say, we don't need any more money, that the government's already given us enough. If the government cuts back on that funding, they might have to charge you $10 or $20. But right now, 80% of all of these plans are $0 per month. It's the truth. But it is not 100% coverage. Surgery would cost me $400. Still better than $7,500. But I would have had to pay a copay to fix my ankle. And I would have paid a copay to have the x-ray on my ankle before and after the surgery. I would have paid $40 or $25 to see my orthopedist. This is fantastic. But what we call this is pay as you go. So when you need care, when you pay for your care, I would have paid my copay each time I needed an x-ray, a surgery, to see the doctor. Under the supplement, we call that prepay, because you're just sending your money off to the insurance company every month and you're prepaying for all of your events. You don't have to worry when you get sick, you keep paying for everything because it's already prepaid. But you have to decide what kind of person you are. My mom doesn't like doctors. She's 83 years old. And she married a doctor. I think of the 60 years they've now been married, they liked each other about 45 of those years. I think we experience but my dad does need more help here than my mom. My mom finally started taking one medicine this year. She had COVID 2 times, and now she's taking a medicine because of COVID. But this is pretty simple. Do you want to prepay for things, or do you want to just pay when you need care? You're not going to beat the system. There's no such thing as a free lunch. You either pay now or you pay later. Your mom and your grandfather taught you that. There's no, you pay now or you pay later. It's pretty simple. The government has set it up for you to choose, and it's a pretty balanced system in that regard. Other things are not balanced, but in that regard, it's very balanced. Any questions about this? No, you good? All right. I'm not
I have Medicare Plan G.
okay.
Right. So after the doctor filed insurance file for Medicare, and I pay my deductible and all that, they shouldn't be charging me anymore.
That's correct.
So how come I'm getting a bill?
Okay. So I'm going to restate your question, but I'd like to hear it, okay? So he has traditional Medicare, a Medicare supplement, and he should be getting 100% coverage after he's met his $226 deductible, but he's still getting some bills. So remember, if you see a doctor that takes Medicare, your bills are going to be paid 100%. But if you see a doctor who's willing to see you and they say, well, we're gonna take your plan, but we charge extra, then he might not get 100% coverage. But your plan G, you said you were on plan G.
Right.
And plan F also provides 15% additional coverage to turn this into 115%. So if you're seeing a doctor that doesn't take Medicare's base rates, they're allowed to charge 115%. And you shouldn't be getting a bill. If somebody is sending you a bill like an ambulance company or somebody else, you need to call them and say, do you have my correct Medicare information? Because you should be getting virtually 100% coverage. Okay? And, look at your bills. And I'm going to teach you something about your Medicare account in a few minutes about how to look to see if they're billing you correctly. Okay? Don't get excited about any plan until you see their star ratings. Star ratings means quality. The government calls quality ratings star ratings. And that means if you have a 1 star or 2 stars, it's a bad plan. 3 to 4 stars is most common, or 4.5. And a 5-star plan is rare. Every now and then we get a 5-star plan in Georgia. And these are issued around November. We find out the star ratings, maybe even as early as October. So you want to know if you've got a good plan. If you have a good plan, that's good. But if you have a bad plan, they're required to send you a letter that says we think. And they hate to send that letter out. They're required to send it to you, okay? And they hate it. But generally, the plans below star ratings, because they get deducted on the payments that the government's giving them, they get reduced payments. The people running those plans get fired, or those plans are being sold to another company. So really, 80% or so of plans right now are in this good range of average, above average, and we have a few nationwide, 3 to 4% that are in 5-star ratings. Okay, this is important. This is a very good rating system, but they need to tighten it up and make it even tougher. If you get a high rating, you get a high bonus. If you get a medium rating, you get a medium bonus. The companies do from the government. So this is the biggest issue seniors are facing right now. The biggest thing the government is talking about, the biggest issue, finance-wise and stuff, is prescription drug coverage. And remember, this started in 2005. Well, the government was very afraid when they created this new benefit that it would sink the federal budget. So they put a lot of weird rules and weird breaks and things inside the plans, made them very confusing. Has anyone here ever heard of the donut hole? Well, we were promised that the donut hole was going to go away, right? I'm not going to say the government wrote the rules, but the donut hole didn't go away. But it used to be really bad. It used to mean the donut hole meant you had no coverage. You would start out with coverage, and in the middle of the year, you would have no coverage. It didn't. And they fixed it. Now you have 75% coverage instead of having 0 during that time period. So they improved it, but they didn't get rid of it. They didn't improve it. We're getting ready to talk about a bunch of improvements in a second. But look how confusing the government made it. Some plans might have a deductible. Next year, we found out this deductible was $545. But it might not apply to you. Some plans say generics don't apply to the deductible. Some plans say everything applies to the deductible. Got to be careful. You got to read your materials, because in October they will tell you we're going to make the deductible apply to everything. You need to read your materials to get them in October, maybe around the 1st of October. Every plan gets $4,660 of initial pot of money for you to spend on your drugs. Then the donut hole now is only 25%, or you have to pay just $25 of every 100. And the out-of-pocket this year is ridiculous, $7,400. This is going to be massively improved. And Mitchell's going to hand out the sheet. We're going to go over it, not right now, but in a few minutes. It explains all the rule changes we're going to go over at the end of the presentation. And right now, even after you spend $7,400, they make you still continue to spend 5% on your drugs. I have clients spending $10,000 or $15,000 a year on drugs. That's all it is. Okay, big improvements. Starting in 2024, this 5% share payment is gone. Okay, we're going to go over all of that. Now, I want you to know everybody should create a Medicare account. If you don't know how to create a Medicare account, we have a green flyer. This is one show them that green flyer. It tells you how easy it is at medicare.gov, G-O-V, to create your login. It's like you do with your bank, your insurance company. You have a login, and there they know every drug you're filling with your Medicare plan. It gets reported into that system. And it's pretty easy. You can do this yourself. We do it for our clients for free. But it'll tell you, hey, congratulations, there's 25 drug plans in every county in Georgia. So you've got 25 plans to look at. You're all excited. You're canceling all your dinner reservations. You know you're going to study 25 plans to figure out the right one, right? No. Okay. So what happens is they say, don't do that. Just put in your pharmacy. We know your drugs. Tell us the ones you're still taking, and hit the button to go. And it'll say, hey, there might be 3, 4, 5 plans that have your pharmacy and your drugs at a good price. So don't look at the other 21 plans. And there might not be 21 plans this year. There might only be 18. And in 2 years, there might only be 10, because they're revising this crazy number of plans. They're going to be smaller. I believe they're going to be smaller. You do this during the annual enrollment period that starts in October. You log into your Medicare account, you check off the drug you're using, put in your pharmacy. You can put in more than one pharmacy. You can put in 3 or 4 if you want, and compare prices. Costco versus Kroger versus Publix, and it'll tell you right away who's got the best deal for your drugs. 90% of seniors are not doing this. It's so simple, and 90% of seniors aren't doing it. And they're doing the puzzle books, which are much more difficult than this. And the average error 5 years ago was $720 per senior. It's now over 1,000. I know it, we do it all the time. I see it, it's easily over $1,000 error. And the reason it's an error is the insurance companies were doing sneaky things. They were selling you a plan for $15 a month, and then 2 years later that plan was $50 a month. 4 years later it was $89 a month. They were raising the prices on the premiums because they know people were paying attention. They scrape the money. Predatory behavior on fixed income seniors, legalized theft, and you can prevent it by just doing this task. And then also they change your copay. You can get your drugs for free. Next year you're $1 or $5. You're like, oh, that's the inflation. You know, inflation things. No, you're planning on the wrong plan. You need to find the right plan and find that. It's not hard to do. Now, low-income people, I'm going to talk about this when it gets snow, but high-income people actually get penalized, and we'll talk about that in a minute too. The low-income people, what do they get? Sometimes you're not low-income, but then you're south side, and also you're low-income, and happens there. So lots of people. Well, the government knows this, and the government just changed the definition in the Inflation Reduction Act of what is considered low-income. They raised it about 10%. So some people that used to not qualify for this benefit now do qualify and need to reapply. Premium support, they'll pay your premium. The average national premium for drug plans is around $32 a month. The government will pay them. If you qualify for low enough income, they'll also, when you go to pick up your drugs, instead of a drug being $45, it might only be $10. If it was a generic and it was $10, it might only be $4. They have some maximum cost controls, or it might be 5% for a drug. And also, for all those people that get rid of the phases, or most of the people that get rid of the phases, called the deductible and the donut hole, so that people don't have to worry about those crazy different elements. 20% of seniors who qualify for this have failed to apply. And now that they've raised the bar on who qualifies, it's going to be more like 20 or 25%. So people need to reapply. You can reapply at any time you want. They're not going to worry about it. If you have a life change, like a death of a spouse, or you've been scammed out of your money, or something that happens, you need to reapply. God forbid. Okay. So sometimes, though, high cost medication is still a problem. I read an article today that 10 drugs account for $47 billion in Medicare spending. There's 3,000 drugs that are being spent, but just 10 of them are cost about 20 to 25% of Medicare's budget. So some high cost medications, you might have heard about the new Alzheimer's medications and stuff, you might be able to find patient assistance. The pharmaceutical company or a foundation or a charity, someone might provide you with that. We can help you find those patient assistance programs. But But if you're getting cancer treatment, the cancer center is also gonna know about patients, Emory or Northside or whatever. Sometimes people also say, well, wait a minute, I don't have an expensive drug, I have a generic drug, but my plan says it's $8 a month, but I found out either RX Saver or Cost Plus or Good RX, that I can get it for $3. That's okay. It's okay to use a discount drug card, but you're not gonna get credit under Medicare, and it's not gonna show up in your Medicare account as one of your drugs that you're taking, but they do not prevent you from finding a cheaper way to buy your drugs. If you decide you want to buy it from Israel or Canada, have clients that bring drugs back from India, Medicare says we're not giving you credit for those expenditures, okay? All right, and you can only use one. You can't double up and have a double coupon. You can't use your drug plan and a coupon card at the same time on the same drug, okay? So hand this out now, Mitchell, please, to everybody. The prescription drug timeline, if you don't have it, this is a copy of it, but he's got a sheet, you can read it easier and take it home with you. Yeah, Victoria can help. This is what President Biden and Congress passed. This is the new bill, and it starts in 2023, which is this year. Anybody had a shingles vaccine? If you had it this year, it's free. Previously, it was like $300 for the shingles vaccine, but now more vaccines are free. Can't get a rebate, sorry, only going forward, and I can get a rebate. But that's an example of what 2023 happened. 2024 and 2025 is where we're gonna see the big stuff happen. That's just down the road. 2024 is getting ready to happen. And I told you in 2024, they're getting rid of that 5% catastrophic share payment. But a bigger thing that was supposed to happen in 2024 that actually started happening July 1st was insulin savings. Did you hear that the government has gotten companies where that they don't charge any more than $35 a month for insulin for the people under Medicare? You heard that? You need to tell your friends that are insulin dependent diabetics, especially the ones that have the pumps. President Trump created this benefit, but the people with pumps didn't get it. So President Biden fixed it in this bill so that everybody taking insulin, including the pumps, should not pay more than $35 a month for their insulin. And you and I know insulin's been a ripoff for 20 years. It should have been $1 a month 20 years ago. It's been one of the biggest ripoffs in America. But now they're fixing it, okay? Some of our plans give the insulin to certain diabetics for free or maybe $10 a month. But the cap is 35. Well, that was supposed to be 2024. It actually got sped up to July 1st just a couple weeks ago. Now, another big deal is that they expanded the income eligibility for the low-income people. They expanded that by 10 or 12%. But 2025 is the big deal. Remember I told you that a Medicare drug plan can have a $7,400 annual risk? It's going to be $2,000 now. This is a giant gift to seniors. $2,000. When I started doing this in 2006, the cap was $2,600. So we've gone from $7,400 to better than when this plan started. This is an enormous benefit. This also means some of those patient assistance programs are going to be unnecessary. Why are you going to have a patient assistance program when everybody, doesn't matter if you're a millionaire or a low-income person, everybody gets treated the same, a $2,000 cap. A huge deal. This is a big deal. Starting in 2026, 27, 28, 29. Remember how the president said he was taking the insurance companies out behind the gym and wrestle them to the ground and negotiate drugs with them and all that? Well, it's going to be 60 drugs. 60 drugs are going to be negotiated. But remember, I told you that 10 of them were accounting for about 25% of Medicare spending. So they're targeting some drugs. Humira is a good example. You may have heard of Humira, it's a biologic drug for different conditions, or rheumatoid arthritis and stuff. If you go, some companies are flying their employees to Nassau, Bahamas, giving them a 3-day beach vacation. This is a New York Times article. And get Humira because it's $4,000 a month here in the United States. If you fly over or swim over to the Bahamas, it's $400 a month. Is that not ridiculous that we're getting ripped off? And so the government says, this has to stop. Why are you stoking us? That's like a tax. It's basically a health tax for something that other countries are getting cheap. And you can go to Bahamas and get 4 pens, fly home, because 4 pens are considered not smuggling. Okay? Now, that's 60 drugs they're going to negotiate. But here's a big deal to me, right here, is the bottom right-hand corner. Remember how I told you some of the drug plans can start at $15 a month, and 4 years later, they're $80, $90 a month? That's not going to happen anymore. No more abuse by the insurance companies ripping off seniors that way. The most a drug plan can change 6% in price. So if it's $20 a month, it can be $21.20 next year. If it's $40 a month this year, it can be $42.40 next year. No more is jacking up premiums to unsuspecting seniors. That is, this is for me, one of the biggest things because this applies to every senior. This one and the $2,000 benefit. Huge, huge deal. And you're not hearing much about it in the news, are you? They're talking about submarines exploding and stuff, right? All right. Modern innovations. This is where I was talking about all the innovations were pretty much happening in the new side of Medicare, except a couple. Preventive care. It started out originally in 2005. They did an experiment to give seniors preventive care, real preventive care, prostate exams, mammograms, pap smears, that stuff, colonoscopies. In 2011, President Obama said everybody in Medicare gets preventive care. 26 different items. Every health plan in my life has had preventive care, okay? I don't see this as a lot of innovation, but it was for Medicare. But this is the new thing. Number 2, Medicare does not provide you a gym membership to go to LA Fitness or Ladies Workout Express, but it does allow the insurance companies that they want to provide you with a gym membership to do it. And the reason they've done that is that you can study people. The people that were in here dancing before my speech today are healthier than the people sitting at home on the couch. And the government says, let's study it. And they know now that people that use the gym membership have a 30% reduction in healthcare expenses. Dental, vision, and hearing aids. President Biden wanted to add dental care, vision care, and hearing aids to regular Medicare in the Build Back Better bill. Didn't happen. Almost all of the new plans, almost all of the Medicare Advantage HMOs and PPOs have a dental provision to give you dental care, vision, free eye exams, maybe even eyeglasses on most plans, and most plans also provide some type of hearing aid benefit. Not regular Medicare, and regular Medicare doesn't do these things. But people get confused and say, well, wait a minute, Medicare does pay for cataracts. You know, I've got floaters in my eye. That's medical versus routine vision. So if you have a medical event on your eye, that's medical care, and Medicare does cover that. But what we're talking about on vision here is just getting your glasses, getting your regular prescriptions, okay? Now, this is number 3, is the thing that really started picking up speed during COVID, was at-home services. They were giving people transportation, and they still are today, transportation benefits, but it started, we need to give people a ride to go get their COVID vaccine. We need to give people a ride to get to the doctor, adult daycare, over-the-counter medical items, free groceries, and even some plans are experimenting, very few, with home care assistance. My dad, retired doctor, has got plenty of money, but if he got sick, his plan will provide up to 60 hours a year of somebody coming into the house to help them with light duty housework or errands or grocery shopping. And he's like, I don't need this. See if I can pay somebody to do it. My working plan includes it. So he said, all right, that's fine. But something my dad got, and so a lot of our clients got this year, end of 2022, excuse me, they got a card in the mail. My dad got a $500 gift card in the mail from his Medicare company. And I didn't even know he was going to get it. It was a surprise for me. And he called me up and said, Keith, is this a scam? They just sent me this $500 Visa card. I'm like, no, it's not a scam. I researched it. No, they had to rebate back. They didn't use, during COVID, a lot of the services weren't being used, so they rebated back people some of the money. And he says, I can use this for groceries, my utility bills, or fuel. And I said, yeah, that's right. I didn't go pull up the card. And he goes, no, he's got a farm. He went and filled up his diesel tank with his Medicare credit. And I, what does that have to do with healthcare? If he said that, I said, I don't know what it has to do with healthcare, just use the card that. And he did. My mom got one too. Number 4, this is the big one right here. This is what's gonna save Medicare. All these other things are neat and they do help Medicare, but this is what's gonna save Medicare because Medicare is spending 2002 was $6,000 a year per person. This year it's $15,750, and we expect in the year 2035, it's going to be $32,000 a year per person. That is runaway crazy, right? So this is what's probably going to save Medicare because Medicare did not understand until recently that 5% of people, 5 people out of every 100, spend half of Medicare's money. And remember, just 10 drugs spend 25% of the drug portion. So they're targeting now, starting to understand. Before they were just writing checks and just spending money willy-nilly. Now they're actually studying it. And they've been doing this for 10 years of saying, all right, chronically ill people or people that have an illness, a one-time illness, need care coordination. So chronically ill people are people that have 2 or more healthcare conditions like heart and lung disease, obesity and diabetes. Maybe they have high blood pressure and kidney disease. Those chronically ill people, they're targeted with special needs programs. We have special programs for them, especially diabetics. Now, care coordination means you go to the hospital, you're a pretty healthy person, you go to the hospital, have a new put in. Did you finish your cycle of care? Did you go do your therapy? Did you get your follow-up visit with your doctor? If you got a heart attack, did you do your cardiac therapy? Did you finish your cycle of care? And a lot of people don't, they just drop out. And you have, if the care coordinator doesn't call and say, why didn't you go do your follow-up visit? Why didn't you have a ride? My daughter's out of town. Let's get you a ride at the doctor. Let's get you to finish your care. Because people who do not finish their care coordination end up back in the hospital a lot of times for stupid reasons. And this is one reason why we're providing grocery meals. People will get out of the hospital and live alone. Their doctors in Tennessee, sometimes the fact that they're not eating properly, they end up back in the hospital. It's better to spend $200 on food than to spend $20,000 on food. Thank you.
I've seen when I've gone to certain doctors and I'm in the waiting area, and there's this person at a desk and they're assisting.
So certain doctors, especially targeted special high value providers, certain companies in and on that, a person in the office from the insurance company, a representative, to tell me, okay, if you use this doctor, the company is also going to give you free groceries. We're going to incentivize you to use this high value doctor. So they're using it as a marketing tool, and it's sort of bends some of the Medicare rules to do that. And so far they're allowing it. But it is a marketing entity. But it's legitimate, but it's truly a marketing, yes. We have a question. Yes, okay, at-home services. It depends on the plan. So it depends on the plan. I'm going to restate her question. Yes, let me expand on that. So she was asking about at-home services. So there's, besides these special needs plans that are targeted for people that are ill, there are also plans targeted towards people who are low income. Okay? Remember, my dad's not low income. My dad does get 60 hours of home care assistance, even though he's got plenty of money. Retired doctor. But the low income plans are called special needs plans for low income. If people have Medicare and Medicaid, and the government is giving them a lot more benefits on certain plans, depends on your area, your region, and depends on the company, to give them maybe 155 hours a year of somebody coming into the home to cook and clean and maybe even bathe them, move them, help dress them. They're experimenting with that. Not unlimited benefit, but targeted benefits. So it depends on the plan. Low income plans generally get much more robust because instead of $1,100 a month that the government gives the insurance company, for a low income person, they might give them $2,000 a month. They're giving the companies more money because low income often means low health outcome. Low health outcome. So the low income plans are especially targeted for people with Medicare and Medicaid. Medicare and Medicaid. Okay, that's usually the qualifier. But yeah, we're gonna see what happens with this. It started under President Trump, President Biden has expanded it. We'll see what happens, okay? Any other questions here? Yeah. Look. Which one's first? Yeah.
I'm trying to differentiate you a bit.
Okay.
So the difference is, they now going to be under regular benefits.
A few of the supplements, two of the main ones here in Georgia do offer a free gym membership. Okay, the red company and the blue company do. With your plan. The green company sometimes does that. That's under supplements. But almost all of the Advantage plans offer a fitness or gym membership. Only a few of the Medicare traditional supplements do. Yep. So the risk on the Advantage plan was that you did not have 100% coverage. Remember, let's go back to that screen. Oops, one more way. On this screen, if you have a Medicare supplement, you can go to sleep at night knowing you basically have 100% coverage. You don't have the other bells and whistles, but you have, if you get cancer, you know I've got 100% coverage. Under the Advantage plans, you have to pay your copays. I had to pay copays to see the doctor, had to copays to see the surgeon, all of those things, right? My worst case out-of-pocket maximum on the Advantage plan this year is around $8,300. $8,300. Not every plan is that way. Some plans are as low as $2,900, but the government states that the most they can have is around $8,300. That is going up next year. So if you got cancer, you had stage 4 cancer, the disadvantage is you might spend $8,000 or $9,000 out of your pocket. And what if it goes into next year in January? You restart that number restarts. It's not for your one illness, it's by each year. So the advantage to the supplement is 100% coverage. The disadvantage to the Advantage plan is that you have that maximum out of pocket rule. But the advantage to the Advantage plans was back here what we were talking about. Whoops, was all of these additional benefits. Those are almost exclusively in the new plans. So we have people that say, I don't mind having a $5,000 out of pocket risk if I got sick, because I'm gaining $3,000 or $4,000 each year of extra benefits that I need. I need dental care, I need vision care, I need hearing aids, I need transportation benefits, I need groceries. So when people look at this, they're balancing, where do I need money in my life? Where do I need care? Where do I need my resources?
These are all just for the Advantage.
Most of these benefits are under the Advantage plans. Preventive care is under every plan. All plans have preventive care. The Advantage plans, almost all have the dental, vision, and hearing. And the Advantage plans are where you're seeing all these new expansion of at-home services. Telehealth was started, for example, in the Advantage plans, but now every Medicare plan can offer, including traditional Medicare and COVID, has telehealth. But it was first tested out in the Advantage plan. And then this chronic illness management care coordination and all of these things are in the Advantage plan on the new side of Medicare. So most things here, let's say 90% of all this new change is happening in the new plans only. Okay, yes, sir. Great question. No, it used to be too bad. So President Obama fixed this. In 2010, in the Affordable Care Act, he fixed the problem. It used to be on the Advantage plan. You have a network here in Georgia, and you were, traveling to see your relatives in Kansas City, and you got a car crash. You were in deep trouble. And President Obama fixed it in the Affordable Care Act and said, no, if you're in an emergency nationwide, you're always treated as though you're in network. That's a federal law since 2010. when that law was enacted, in 2011, passed in 2010, enacted in January 2011. Now, most Medicare Advantage plans in Georgia are PPOs, which means preferred provider, which means you can go in or out of network. So we're not talking about emergencies now. Let's just say you have a second home. You have a home in Atlanta, you have a home in Palm Beach. You can see doctors both places in the network just for regular care because you have a PPO, a national list of doctors. Or you can leave the list and go outside the list anytime you want. Hold on one second. Under an HMO, that's not the case. Unless you have a very specific HMO that gives you out-of-state privileges, which is rare. Great question. PPO means you do generally get a national access list of doctors. PPO, yes ma'am. So, again, when you see doctors under Medicare, you need to ask them if they accept Medicare. And when they see your card, they have to tell you, I'm out of network. And then you have either, on most plans, you're gonna have a higher charge for seeing that doctor. But you're protected because you're seeing a Medicare provider. It's not the Wild West. You're not gonna see a doctor go from $100 to $500. You're gonna be protected by the Medicare National Fee Schedule. So the doctor says, yeah, I think Medicare, you're not allowed to charge you above that Medicare fee schedule. Yes, because if they tell you they accept Medicare, then they're having to use the Medicare fee schedule. That's correct.
So the out-of-network doctors are people charged with certain bills.
That's correct. They're participating in Medicare, they have to participate in the Medicare National Fee Schedule. And then that means you get charged based on that fee schedule, not some crazy number. You've heard horror stories of people getting charged crazy numbers. That doesn't happen if you see a Medicare provider. You're protected by the federal fee schedule, even if it's out of network. If the doctor accepts Medicare, you want to use providers that accept Medicare.
If any of the plans cover you when you travel overseas?
Great question, okay. It's a big crowd there. His question was, do any of these plans cover you for international travel? Medicare does not pay for international events. Does not. Most all of these plans do. If you have a plan G, you have $50,000 of international travel coverage. That was under a traditional Medicare supplement, plan F and plan G. Something like 90% of Americans that have those plans have F or G. And that has on the back of that sheet, we have back there, this sheet right here, I'll show you. Right here. It states international travel, right at the bottom line. The bottom line shows that you have international travel coverage. The Advantage plans, most, I'm not going to say all, most Advantage plans provide you between $50,000 and $250,000 of international travel coverage. The largest provider of Advantage plans in Georgia provides you with $50,000 of international travel coverage. The second largest or third largest provides $250,000. Can they change that next year? Yeah, they're allowed to change that because Medicare doesn't require them to cover international travel. That's an optional thing they're doing to help you. So I tell all of my clients, when you travel internationally, you should buy, if you're going with a group to Israel, they probably have a group travel plan you can buy into. I'm traveling individually. I just went to Greece, bought me a travel plan for myself and my partner, $120 for a 17-day trip for international travel coverage. It's not bad. For an older person, that might be $300 for a couple. So don't rely on your Medicare plan because the most expensive thing for international travel is not necessarily the care. I don't want to be treated in Greece. I want to be flown to Tel Aviv to get my heart surgery done, and I want to get done in Athens, Greece, probably. But that flight, the flight home or flight from Egypt over to Tel Aviv, that's where they jack you up and get you $25,000, $40,000 in bills. I've had clients. I had a client had a fall on a cruise ship near Bahamas, helicopter ride to Nassau, plane ride from Nassau to Miami, $47,000. Just from falling and hurt their back, you know. And then they charged also for the spouse who tagged along. Well, if you have travel insurance, it covers both you and your spouse or your partner, a companion, who go together, okay? So always buy travel coverage, but don't overspend on travel coverage, okay? Sometimes the travel agencies kind of rip you off on that. We have it on our website, okay? Okay. Now let's talk about this. We gotta watch our time. We're running out of time here. Enrollment periods. Everybody gets the initial enrollment period of when you turn 65, of signing up for Medicare. If you're still working and you don't need to sign up for Medicare, or you need to have some other decisions going on, you can wait until later and use what is called a special election. I am now 68 years old and I'm retiring from my job. That's a special election. But also a special election might be because I'm moving from Decatur to Long Beach. That's a special election. But every year we get special election codes like tornadoes, floods, storms, peaceful protests, all sorts of things, reasons to help people with their Medicare. COVID was an entire year, 2 years of special elections. But here's the next one that's coming up onto us right now. October 1st, we get to see the new Medicare plans, and October 15th, we actually get to start enrolling people for 2024 for January 1st. October 15th to December 7th. Why do they stop on December 7th? It's because that companies have to process your application and mail you a new card so you can start using it January 1st. This is a new period right here, the advantage election period. This is what President Trump created, and we needed it for years, for people who did not do their annual review, and they find out in January that their doctor's not covered, or their hospital, or their drug. Now we get January, February, March, where we can switch them from a plan to a different plan. I get calls from nurses and social workers and other people saying, can you fix this person's plan because we can't get them the right specialists? And we fix it during January, February, March each year. Special election. Low income people, I can fix all year long. Low income people, I can fix all year long. Now, I'm going to skip this one real quick. People sometimes take COBRA instead of Medicare. That's usually a big mistake. If you need somebody on COBRA, like a younger spouse, that's fine. But if you're Medicare eligible, go on into Medicare. Call my office, I can describe that to you. If you do this wrong, you can have a lifetime penalty under Part B, which is severe. It's 10% of your premium per year. So $16, $16.50 per year. Part D is also a penalty to drug plan. If you don't sign up for a drug plan, I have a friend who just called me yesterday. She didn't sign up for one. She can have a $3 per month penalty the rest of her life on her drug plan because she's not low income. High income people get surcharged for their income. Low income people don't pay penalties. So you don't have to, if you're low income, you got a penalty, they will waive the penalty because they're trying to help you, not hurt you. Okay. Now, how to sign up for Medicare through Social Security? Online is best. Try to do it 90 days out. It takes the government about 30 days to process your request, depending on the time of the year. And then the card comes in the mail, but you can also see things on your online account. I'm not hurrying through this real quick, okay? I'm over my time.
Oh, no, you're not.
There we go. I'm okay? Okay. So Medicare, I know you all feel like you're an expert. I gave you more information than you could possibly imagine today. Don't feel bad. You're not going to be an expert in 45 minutes. You're going to be an expert if you go to the Medicare website every day and become a nerd. Or just enjoy a bunch of nerds in the office and will help you become a Medicare expert. All right. Medicare does not cover everything. If you want to have permanent full dental coverage, you can buy your own dental insurance. Medicare says that's fine. Medicare says Medicare covers heart attacks and strokes, Medicare covers cancer, but Medicare says that if you want to buy a plan from the duck, you see the duck on TV, you want to get your own heart attack insurance, that's fine. Medicare says we don't care. Medicare does not pay to bury you, does not give you life insurance. You have to get your own burial insurance or life insurance. But here's the one that gets most confusing. Medicare does not pay for assisted living or at-home care, even though I told you about some plans experimenting with giving some at-home care. If you need to live in an assisted living facility, or if you need a nurse to come by for 8 hours a day, 5 days a week, Medicare does not pay for that. You need your own long-term care insurance, or your got low enough assets and income, VA, Veterans Administration will give you coverage. But what Medicare does, it gives you 20 days free of rehabilitation if you qualify. And Medicare provides another 80 days on top of those 3 days that you have to pay for, or if you have a Medicare supplement like Plan G, it pays it for you. So the max you can get under this type of care is 100 days. Most long-term care insurance policies have a 90-day waiting period. The reason they have a 90-day waiting period is because they know Medicare covers up to 100 days. But it doesn't mean you qualify for that. If you have a new hip, you're not the same as the person that has a massive stroke. Okay? So you might not get these, even though it says it here, Medicare says, we will determine whether or not you qualify. All right, let's get through this. We're on the last two screens here. Remember, there's two ways to access Medicare. Half the people at age 65 are on the new plans and half are on traditional plans. Your decision is not permanent. You can move between those plans, and we do that with our clients every year. Medicare does not cover everything. The annual enrollment period is October 15th to December 7th. Low-income people and chronically ill people get special plans and special privileges. Very important. Okay, remember, it's a process. Give yourself 3 months. Takes about a month to get things organized. That gives you some time to shop. Either your retirement date or your birthday happens. Even if that's in October, you still want to review your plan, especially the drug coverage, especially now. Okay, that's my company, Affordable Medicare Solutions. We've got all of our plan information, all the different flyers, everything on the back table. Don't forget about our YouTube channel. And don't forget that we also post a lot of things on social media, new rules and new things. You can follow us on Facebook, Affordable Medicare Solutions. Okay. I think you have a copy of this with you.
Yes, we do.
And she's
And Mitchell will send me anything that I need.
Yeah.
That's not, we can send you everything. And we did record this session, so we can send out the link as well if you want to refer back to it. And, the handouts are in the back. And it's coming back during the enrollment period.
Quick question. Folks, is it likely traditional Medicare will go?
Okay, I'll restate this question or re-say it. He asked, is it likely, that was a key word he used, is it likely that traditional Medicare, classic standard Medicare is going to go away? No, it's not likely. Is it likely that Medicare supplements that you see, remember the traditional Medicare supplements, like Plan G? That market is shrinking every year. And they are worried that the Medicare supplement market might kind of implode in 10 or 15 years because it's shrinking. You need a healthy market to have a big pool of participants, right? But it's shrinking so much. So the area that we're worried about, not today, but maybe in 10 or 15 years, are those supplements going to go away? But traditional Medicare will not go away. No. Okay. Good question. That's my opinion. And we'll see if I'm right. Okay, well, the federal poverty limit is not a qualification. The federal poverty limit is around $13,000 a year. It used to be 138% was the qualifier. President Biden moved it to 150% under the new rules. So you take the federal poverty limit, multiply it times 1.5, and that's the qualifier for low income subsidies. Good question, very good. Not for Medicaid, that's for the drug plan subsidy. Yes.
So you said to switch, is it really easy to switch and go one direction or the other, that it's harder to?
Yeah, that's a good question. And so, do I have time to answer that question? Okay. Okay. So her question is it easy to switch between traditional Medicare to Medicare Advantage? It depends on the state. So we're going to talk about Georgia, because we're in Georgia, okay? So when you're under Medicare Advantage, only you're under Medicare Advantage, every year you can bounce between any Medicare Advantage plan and stay on that side with no health questions. It's just checking the box. You can switch, easy peasy. Drug plan is the same way, easy peasy. When you say, well, wait a minute, I've got a Medicare supplement and I want to go try a Medicare Advantage plan. The government gives you a 12-month free rule, 12-month trial right. that if you're under a plan G and you say, I want to try out one of these plans and see about these benefits, anytime during that 12 months, you can raise your hand and say, I don't like it, I want to go back to my plan G, and there's no penalty and no harassment, you get to go back. Sometimes actually the premium goes down, it's kind of weird, sometimes it actually consumer benefit. Now, if you are under an advantage plan, I'm under a nice PPO plan, I love it for 5 or 6 years, and I get cancer, and I said, you know what? I think I'm gonna go get a Medicare supplement. Okay? Yeah, you can sometimes. So, you'll see some videos online that say you can, but it's not true. So it depends on the circumstance. In Georgia, you have to answer health questions. They say, do you have cancer? Do you have Parkinson's? And so if you check those boxes, you probably aren't gonna be able to move over to a supplement. Unless you have a special thing that happens to you. So I had a client who was in Decatur, had his house in Big Canoe. He's on an advantage plan here in Decatur. And he said, Keith, I'm selling the house. And I said, what's going on? He goes, well, I got some health concerns and all that. And I said, well, tell me about it. So I did. So he moved to Big Canoe up in Georgia. He said, can I get a supplement? Yes, because he lost his advantage plan because he was moving outside of his service area. He was guaranteed a plan F, actually, F or G, and all his cancer treatments, all the Parkinson's or whatever he had, it's all immediately covered under the supplement. So we look at those circumstances, look at that, but in some states, there's 5 states where there are no health questions. Every year, you can just check a box between a supplement or an advantage plan, but not in Georgia. Let's get a question. Did you get it loud?
Allow you to decide your opinion. Like, if he's already done with cancer, I don't think there is some discipline to get off this supplement.
That's why I just explained this. So if you have to answer health questions, it's not as likely or as easy. So if you have to answer health questions, there's 3 outcomes that can happen. They can either say no, you're not allowed to go, but that's not every company. Every single company has different underwriting questions. So one company might say no, whereas another company might say yes and charge you additional premium. And another company might say yes and not charge you any additional premium. So there's 3 outcomes. You can either get a perfect solution, you can get a hard no, or you can get a maybe. And people get frustrated because they'll try to do it on their own, and they'll go apply to the blue company, get turned down, and say, well, I can't do this. Instead of knowing they should have gone to the green company, and the green company would have said, yes, but I'm charging you 15% extra. Yes, ma'am.
The switching can only be done during open enrollment period.
Most of the time, that's correct. Unless you have a special thing like you're moving, you have some other special thing, but in general, it's that annual enrollment period, October 15th to December 7th. But remember, I told you people can change January, February, and March under the HMOs and PPOs every year if they fail to make a change during the annual period. So a lot of people just ignore, they're too busy with the holidays and forget to do what they're supposed to. And then they get a shock in January if their doctor's not on their plan anymore. Now the government says they can fix their plan. Okay, good question. Yes, sir.
I'm not recall, I'm too young for Medicare. When I first find out, if I have kids of my health problem, did I go traditional?
So that's a great question. He said, when he's signing up for Medicare, we have that conversation with our clients. What is going on? You know, do you have expected medical care? Are you currently under care? Are you currently having problems? And Medicare knows that oftentimes people go straight into a Medicare supplement and don't do the advantage plans because they want that 100% guarantee of coverage, right, of everything without any big expenses. Again, that is contributing to the problem of the shrinking Medicare market, where you have a shrinking market and more of the sick people do join those plans. It's going to create a spiral effect. So the government is paying attention to that phenomenon right now. And a lot of times it's not even bad illnesses. People are just waiting because their Obamacare plans have high deductibles, $7,500 like mine. They're waiting until they get on Medicare to get their new knee and their new hip. They're not sick people. They just need a new shoulder. And they're hammering Medicare in that first year. That's why the Medicare premiums have been jumping these last couple of years because of Obamacare. The Obamacare plans have such high premiums that some people don't even buy them. Or they have high deductibles and people are like, why do I even want to use this? But I'll just wait 3 months to do it under Medicare. And the government is studying this because it's creating these cross problems. Actual cross problems. I thought when people come and say, "Keith, should I do my DL or should I wait 3 months? Just wait 3 months to do it.
When was that?
Yeah, typically people that are sick would generally go towards Medicare supplement when they first go to Medicare. Especially if they're major sick. Now, if they're later on, we have the chronically ill program for chronic illness. For people that have heart and lung problems, diabetic problems and stuff, the government is trying to create more solutions for the chronic ill under the new side of Medicare.
So I came back to the States May last year. I got myself in some plans right away. And so it's been about a year and nobody's ever said you have to re-up for your plans or whatever. And I haven't been thinking about it for a long here today.
Let me restate.
Like companies, are you typically reminded to, or automatically?
You're not, so let me restate her. She came here, she signed up for some plans, and nobody has told her until now that she needs to do her annual review. Why would the company call you and say, do your review? They would rather just let you post on your current coverage, okay? That's more profitable for them to let you automatically renew. And Medicare, all Medicare plans automatically renew for next year, unless you get a letter in the mail that says we have canceled your coverage. And sometimes that happens, rarely, but sometimes it happens. But in general, all plans automatically renew, and that's super profitable for the insurance companies. It's super profitable for the typical Medicare agent. The typical Medicare agent is a set it and forget it agent. They just want you to sign up for a plan and you never talk to them again, so they can go play golf. Because they get paid the same whether you stay on the plan or change to a new one. And they would rather you just post on your current coverage. That's exactly the opposite of what you should do. You should be an active consumer and do a review each year to make sure you're getting the best plans, because the government is changing the drugs and stuff. And also the plans, if they get a 3-star rating 1 year and then they get a 4.5-star rating, they're getting bonus dollars. They're creating new plans with extra benefits with those bonus dollars. So don't just coast. Definitely on your drug plan review it. Definitely if you're on an advantage plan review it. If you're on a Medicare supplement and you're 70 years old, you've been on a state supplement for 5 years, you probably need shop your price. Even under traditional Medicare. I had a guy go from $500 a month to $180 a month recently. He was on a Medicare supplement for 12 years and had never stopped the price. I just changed my car insurance from Encompass Insurance to auto owners. My agent said it's going to save me 15%. It's like a little gecko on TV. 15%. All right, we're finished, I think. Okay, thank you so much, everyone.
We're glad to have you back in the hall. We'll be filled with even more good questions.
Okay, good.
That's okay, you know, because first of all, they need to be informed and they need to know they can call and ask. That's important because these folks.
Hopefully they'll,
Yeah,
they always do. They always go, every time we talk here, my staff knows they're gonna get about 10 phone calls.
that's what that's the purpose of you being here, you know.
No, they actually don't schedule employee meetings after I speak here because they know the phone's gonna be there.
Oh, good, I'm glad, because that's what I want you to benefit from your time
Oh, yeah.
here.
No, they do. They call.
Good, good, good.
So, traditional Medicare. phone.
That's what.
Well, you have to qualify for Social Security disability. So you have to use a loan here. You don't have other information. You don't have to use it. And you have to do that. So when you build in more systems, next year will help gradually.
I'm sorry, I didn't even know it was more.
Yeah, so all the screen here, the woman work Medicare, we charge for our.
following, go ahead and book with Paul or Cindy. Paul and the funds are like you and for doing your voluntary review. Medicare's a little bit, and then we'll automatically set you up the following year for an October review. Okay, sounds good. All right. Have a great day.
You could.
Government does have 5 individuals to do that have additional duty. If I'm right, if you're not like a bottom to do that, I would stick with strike that. I would stick with strike that. If somebody tries to know you, oh, you need to improve your practice, I generally do that. My daughter has not. Don't mess with your head. Don't mess with your tractor. There's some neighbors in here that should have been there, and they don't have it with their tractor. You heard that tractor. You heard it. Thank you for your service. My daughter's in here. You know, I wanted to go to the course. I found out when I was 14 years old. I was gonna suck this in that job. It's that. Read all your trying to materials. I wouldn't mess with it. You're allowed to make changes. My recommendation is that.
We don't.
So there's, it really becomes complicated, and that's what people get hurt with. They're allowed to do something, then they have to deal with the building systems, because it becomes a real task.
We don't.
Thank you. You got fantastic. Yes, thank you. No, we've got to go right here. Oh, what? If you change your tourist visa to another type of visa, then you might not be Medicare.
But not under- Okay. Sorry. Not time, but I'll give you the first. Sorry for this. So 85 days.
That's what I've got to figure out. Some of these little numbers.
Yeah, we want at least 138. You have traditional Medicare with Southern.
Yeah.
Who are you with right now? Blue Cross, United Healthcare. Okay, good. That's a great one. But they also provide the drug.
Yes, next one I'll have to be.
So you have to get the dental retirees, plan website, and follow that. We're going for September, make sure they choose like drug, if they have any options, they might not have any options, see if they have any options. And if they do, they would have a tool when you enter in your drug. Make sure you're on. So now it's your name.
Right now, I'm saying.
$3,600 a year. We need to ultimately cost close to $3,600. Free payment, that's free payment, you're spending that money off, even if you're not sick, you spend that money off. When you're sick, you want to pay anything out of your pocket as well. You free payment. I know, but you free payment. Because you're already paying the Delta programs to know if I get sick, I'm not going to Delta free cash. We're doing fine. Don't worry, you're good. Just that they offer a different model. If they have one or two different options in the drugs, just make sure you're on the right option. Sometimes they do, sometimes they don't. Well, it might be changing because of the law. Yeah, in the booklet, if they say, hey, I'm like the morning, hey, new thing for next year, just read that. Okay. All right, have a great day, and I'd love to help your brother.
Yeah.
Okay, good. Okay,
I'm Jeff. Now, I came out on the supplement, so that's really and G and me and I really both of us make these things. Pretty good, yeah. And she has cancer, so it's no advantage for me, which probably advantage. Which and she cancer with the fact.
You need to find the right drug, and you probably have to be drug.
Yeah.
So you a drug review.
Okay.
What companies?
ARP, I can help them for the supplement. Yes. And I actually was with them on thing F, when I switched to G.
They like.
So, but from what you've been saying, I mean, this, the market is shrinking, so.
G is a bigger pool. So F of that market, F is remaining faster. She is still growing, but that part of my, part, and she is standing overall. Because of what's going on in the whole market district, but she is the most stable part.
So I also switched my truck plan. Because I wasn't paying any thing for my trucks. And then they stopped charging, and then I switched last year to, I think, well, and now I don't pay anything. So I need to review it I need to review that every year, this is soon. Okay.
Especially this year, 2025, especially.
Okay. All right. So you say I can go on the website and, check.
Yeah, that's right here. Hey, Mitchell, do you have anything about the Medicare? Do you have a Medicare account yet?
No.
Okay, give me the green one and the red one, how to do a drug review. Jeff, he'll give it to you over there.
Okay.
All right.
All right.
Have a
And then no chance that the supplement is gonna have the eye and the.
United Healthcare doesn't do that here in Georgia, but we have other companies that do. So we can get you eye and. Okay, we can get you, the eye and dental, you can call my office.
Okay.
Yeah. You got the card?
No, I do.
You got it, okay. Nice to
Okay,
meet you.
thank you.
Thank you.
Yeah.
Thank you very much. Appreciate that. Thank you. Appreciate that.
They're very professional, I could say.
Practice helps.
So where you moving to Florida?
No, I live in, I'm not leaving Georgia. Oh, I don't know. My girlfriend's from Columbia. She wants me to move to Columbia. So I don't know. Well, I've had a girlfriend for 13 years, yes. I guess she's my significant other, right? I don't know how to shut all that down. You can handle this. And I think I turned this off to save the
It's
battery.
okay, that's all right. We're good.
Okay.
We've just finally gone.
What's that?
He's funny.
What is it? We're married for 20 years.